Hello, everyone. This is Candace, the Preventionista. Happy Black History Month, and welcome to episode 3 of Mental Health Conversations. This month's topic is Black excellence within mental health. Black excellence within mental health, you may ask? Yes, I want to highlight a few Black female and male mental health professionals. Referencing the article, How Diverse is the Psychology Workplace, published on the American Psychological Association's website, in 2015, 4% of psychologists were identified as being Black or African American. Despite those statistics, for psychologists, on a doctoral level, I've met a good number of counselors or Black counselors and therapists. So, I think, even though they're not on the doctoral level, there are a lot of bachelor and also master's level Black counselors and therapists who are, shining in the mental health field. So today, I want to talk about it. And with me, I have Tanisha Moore and Jasmine Henderson. Hey, ladies.
Hi.
Hi.
So starting with Tanisha, can you tell me about yourself? Like your location, your title, and how long you've been in the field?
I'm located in Philadelphia, PA. I have been in the field for about 8 years. Not doing counseling directly, but in the mental health field, doing forms of different portions of therapy, like group with mental health children. So I'm currently just listed as a counselor, master's level counselor, and I'm working on sitting for the licensure exam in April.
Okay, nice. Jasmine?
All right. So again, I'm Jasmine Henderson. I'm a national certified counselor, also a mental health professional and an artist in Pennsylvania. I've been in the mental health field about 4 years, and I have experience in higher education setting, community setting. I've worked with teenagers and children, adults. I've kind of done a pretty good variety, and I have to say I pretty much enjoy all of the settings.
Okay, that's so good to hear.
Yeah.
Okay, so awesome. Thank you so much, ladies, for introducing yourselves. So let's get started. So the first question, I want to start with you, Tanisha. When and how did you get into the mental health field?
So I started working in a group home setting, and I kind of started fresh out of college. I did some volunteer work first, and then I switched into working for the group home.
Jasmine?
All right. So my interest in the field began while working in higher education. I noticed that a lot of students were having difficulties, and it wasn't really directly involving their academics. It was more of mental health things that were impacting it. And I wanted to be able to support them. I wanted to learn more. So that led me into going for my master's in mental health counseling. But prior to that, I worked alongside counselors. So, I talked to them kind of about all right, how did you get into the field? What are things that you've noticed? What programs did you go into? So I was kind of doing research, and, also around that time, I noticed that there was a need for Black therapists, and that I could definitely be one of those therapists, you know what I mean? So I've always been someone who wants to know more, wants to learn. And, my professor always says, you're a curious learner. And I have to say that that's true in that, I always want to learn more and I want to help. So that was what drove me to do that, to go into the field.
Oh, okay. Starting with you, Jasmine. Do you belong to any associations that has helped you or is helping you right now along your career?
So I wouldn't say that I'm currently a part of any associations that have helped me for my career. I would say really what's helped me is kind of like the connections that I've gained throughout the years and the opportunities that I've taken, or just the stepping out on faith kind of thing that has just kind of given me opportunities and led me to more opportunities.
Okay, great. Tanisha?
Yeah, I would have to agree with Jasmine. I'm a part of American Mental Health Counseling Association, but I wouldn't say that necessarily it has helped me in my career per se. It's provided me with a lot of literature in terms of, which type of articles I could verse myself on, or groups and things that are talking about certain things that I'm trying to learn about, and also having access to different trainings. But other than that, I wouldn't say that it necessarily helps other than in those areas.
Okay, I understand this. So they provide additional education and stuff like that.
Okay, yeah. So as a therapist and thinking about clients you've helped and future clients, do you believe people need to believe in something bigger than themselves? I'm not a trained therapist, but I know spirituality is not usually discussed with clients unless you're like a religious therapist, right? Is that correct?
For the most part, I think in our teachings, we're kind of taught to err on the side of caution, to not necessarily discuss religion unless it is a religious belief of the client. So you have to be cautious to not spread your own beliefs onto them. But I definitely think that they need something to be grounded on, something that they can use as a motivation. And sometimes religion is that for a lot of clients. It just depends on what type of religious beliefs they have. And once they talk about if religion is important to them, then I focus on that and try to educate myself more about whatever religion they are interested in, and even if it's different than my own.
Nice. Jasmine?
Yeah, I agree with Tanisha. It's I think it's important to have a purpose or a goal. It may or may not be spirituality. It may not, it might just be something that's really just driving them. But I think it really does, you really do need something. And I would say, as a therapist or a counselor, we do work with clients to goal set, to help them progress in things, and to help them reduce the symptoms that they may be experiencing that could be related to anxiety, depression, or boredom, or whatever that's kind of like taking them down a different path. But even if they didn't necessarily know what that goal or purpose is, we can also help them experience.
Exactly. Yeah, that's good. What pointers can you give people who are afraid to seek help because of the stigma of, having mental health issues, and more specifically, like the Black community?
I want to say that it's important to nurture your mental health just as you would do your physical health. Because if you are lacking or struggling with mental health, it's going to show up in a variety of ways. It could be in the workplace, it could be with your family, it could be, just within yourself. You notice things aren't right. And I would say if you're feeling that way, then you definitely do want to seek help. Now, of course, the stigma is there, right? You don't want to be labeled as this or that. But I think it's important to, maybe talk to other people who have sought out therapy, or to do some research. First of all, I would say to list out your wants and your needs. What do you want to get out of therapy? And then if you have those kinds of ideas, even if you don't, it's good to research, mental health therapists in your area to see if they're going to meet your wants or needs. Interview us, there's consultations. Interview us to see if we are going to be a good fit for you, because it's important. It is your health, and we want to make sure that you are with the right counselor too, because every counselor is not for everybody. So, you know, you may have to go to a variety of different people, various different people till you find the one. And that's okay, because we do the same thing with doctors in healthcare, where that one doctor we go to, we may realize that's not the one. So we need to keep going, you know. So I would just encourage people to not be discouraged if you go to one that is not necessarily a good fit, and just keep trying, and, you know, keep trying to help yourself.
Yeah. I definitely agree with Jasmine. You made a lot of good points in terms of how to go about, you know, stepping out of that comfort zone. For me, I would just say my best advice would be to find out exactly what you're looking for in a therapist, in terms of if race is a factor, right? If you are worried that maybe you're not going to relate to me or to understand what I go through, or maybe your approach is not something that I need. So it's definitely a trial and error type of process, and it could be long-winded. But I would just say to take a step out on faith in terms of, you see that you need some services, you see that things are not going your way, things that are difficult for you to handle on a day-to-day basis. It's okay to get help, and just to step outside of whatever you've been taught in our childhood or in your family, because everybody's experience is not going to be your own. So you may have a poor experience with a new therapist, but then you like your third one that you go out and try. So just keep going at it, and that would be my advice.
Yeah, and I think, you know, the key point out of this question is to keep on going, step out and seek help. Do you have any projects going on right now, or anything you want to promote, Jasmine?
Yeah, I will. I have a mental health blog called Exploring My Wellness, and you can reach it at exploringmywellness.com. I do something called Feelings Friday to kind of help people you know, gain some insight on, or some awareness on their feelings, and explore them a little bit more. And I also created a stress coloring book called Color Be Well, an adult coloring book with stress relieving designs for Black women. Like I said, I'm an artist too, so I do both things and enjoy them both. And I also have an art business with my siblings called Artsy Black Fan, and we also have a new coloring book there for people of all ages. It's called The Beautiful Struggle, and it kind of is our little phrase dealing with or pertaining to COVID. So the feel good designs in there to kind of get you into activities that are not going to, or are going to help, you know, relieve stress as well. But we have all different types of art there, so you can check us out at artsyblackfan.com.
Nice. Okay. Tanisha?
I haven't done anything necessarily in mental health per se, aside from a candle company that I'm launching. And it's centered around, you know, the mental health purpose, because I am a therapist, about how you can use your candles in terms of self-care, for aromatherapy type of things. It's my favorite choice of self-care. So that's what I'm launching. And the company is called Glow Sense Candles. And you can find us on Instagram.
All right.
Nice.
I'm looking forward to seeing more of you guys on social media. And I know I did attend one of your coloring sessions, Jasmine. And that was a lot of fun.
Yes.
And I can't wait to try. Yeah, I can't wait to try candles, Tanisha.
It's awesome.
I know.
I like the coloring books because I like to color, and I think that is very therapeutic for even adults.
Yes,
something that I
absolutely.
recommend.
Yeah.
Thank you guys so much for being here and sharing words of wisdom for those who want to get into the field, and also to those who want to seek help. Everyone, thanks so much for listening, and please tune in for part 2 of Black Excellence within Mental Health, where I will discuss this with men in the mental health field. I want to hear what they have to say. Thanks so much again, and stay tuned.